All right, everyone. Good evening. Let's go ahead and get started here. So, welcome. This is going to be my second live lecture here doing Zoom, and I'm going to talk about the kinesiology of the knee. All right, so let's get started here. So, the three major bones we're going to talk about in regards to the knee are the femur, the tibia, and the patella. All right, so just as a quick review here, your femur is the bone that's comprising your thigh. It's your thigh bone. The tibia, as we went over last time, we went over the foot, ankle, and lower leg, is your shin bone. So whenever you hit or bang your shin, that's your tibia. And then the patella is what's commonly referred to as your kneecap. All right, so what are the actual joints in the knee? So we technically have three joints, two of which we're going to see a little bit more movement with, but most of the movement that we know of and referred to in the knee is what we call the tibiofemoral joint. That is our true knee joint. So what I mean by tibiofemoral is that it sounds like tibia and femur. You kind of putting these together. It's the articulation between those two bones that allows us to do the majority of motion in our knee. And that's really in terms of just physical activity, general daily life movement. That's where we see the majority of the movement in our knee. The next one you see there is the patellofemoral joint. So the articulation of where that patella sits in the groove of your femur there. There's a lot of anatomical terms that we could go over, but that articulation between the patella and the inferior aspect of the femur there, how that patella is sitting in that space, there is some movement there, which we'll show you in a little bit. And then lastly is the superior tibiofibular joint. So that's where you can see the head of the fibula articulating with the lateral aspect of the tibia. Not a whole lot of movement occurs there, just like same with the inferior portion. There's not a whole lot of movement, but because it is an articulation between two joints, an articulation between two bones, we're calling it a joint here. Okay, so let's look at the actual movements here. So what we have first, we're going to look at the tibiofemoral joints, or again, our true knee joint motions. So we're going to go through knee flexion and extension. So this first video I'll play, this is what knee flexion looks like as I'm bringing my heel towards my butt. That is knee flexion. And in the process of where my knee is straightening out, that is knee extension. Okay. Then in the next picture here, I'm just showing an example, but of it seated. So you can see as I bring my leg down and my heel touches the floor, that's knee flexion. And then as I'm making my knee straight or extending it outwards, that's going to be knee extension. In this last video here, I'm just showing how, with the patellofemoral joint, how the kneecap does move on the femur. So there's some gliding or translation, if you will, of that patella on the patellar groove of the femur. Okay, so here I'm just literally pushing my patella back and forth just to show that it has some movement. Okay. Oh, excuse me. There we go. All right, so some biomechanical faults. So we have three different ones that I'm going to talk about here. We have genu varum, genu valgum, and then genu recurvatum. All right, so genu varum is what we commonly refer to as someone being bow-legged. Genu valgum is someone who's commonly referred to as being knock-kneed. And then someone who has genu recurvatum has hyperextended knees. So you can see with the genu varum, their kneecaps and legs and thighs are all bending outwards. With genu valgum, everything is coming inwards and towards together. So you can see the insides are the medial aspects of their knees coming together. And then you can see how in genu recurvatum, they have a back knee or a hyperextended knee where their knees are literally look like they're going backwards. And so we're going to look at how some of these positions look like during different exercise movements and how this kind of plays a role in terms of us being able to go through life and daily activity and physical activity and athletics. So, but before we do that, let's go through some of the muscles here of the knee quick. So again, we're really going to look at just the muscles that are acting on the knee. There's a lot of muscles on the thigh and especially on the superior aspect of the thigh, but we're looking at muscles on the thigh that are going to act on the knee. All right. So the right half of that picture there, we're going to go through that first. So this picture is a right knee / thigh. I'm sorry, I'm getting myself confused. This picture is showing you a right thigh. And we're going to go on the left half of this picture first. So the left side is showing you the anterior aspect or the front of the thigh. Now, in the front of our thigh, we have our quadriceps. All right, so there's 4 different quadriceps, quad being the prefix meaning 4. So there's 4 quadriceps, and these 4 muscles are the rectus femoris, the vastus medialis, which is of course going to be the one that's most medial, as it has medial in its name. We have the vastus lateralis, and just as the name implies, lateral meaning towards the outside. It's going to be the quadricep muscle on the outside, and it is the largest of the 4. And then the vastus intermedius lies directly underneath or deep to that rectus femoris, okay? Again, all of these guys as a group, they're going to help us. They're primarily going to do knee extension. The only exception to this is with the rectus femoris. The rectus femoris also helps us with hip flexion, but that's something we're going to get over and discuss tomorrow when we go over the kinesiology of the hip. All right, but right now we're just looking at the knee. The quadriceps, all 4 of them together as a group, do knee extension. Now, if we look at the right half of this picture, this is the posterior thigh, and this is where we're going to see our hamstring muscles, okay? So there's really 3 hamstring muscles here. On the lateral aspect, we have the bicep femoris, and then on the medial or on the inside aspect, we have the semitendinosus and the semimembranosus. So you can see with the bicep femoris, though, there's almost like a little white piece in there, and it almost looks like it kind of splits in a little bit. There is technically a long and a short head to the biceps femoris, but because it's 2 different heads of the same muscle, it's still one muscle, just like our biceps brachii or main biceps muscle. It has 2 different heads, but we still classify it as just one muscle, okay? And together, these guys, as we come and refer to when they act on the knee, they're going to flex the knee. They're going to help us bring our heel to our butt, okay? And then this is just another perspective to look at these muscles here to just, again, offer another perspective. So let's go ahead and keep going here. So let's look at, remember last time we were looking at how the ankle motion differs between a back squat and a deadlift, or just a squat and a deadlift. But now let's look at what's happening at the knee, okay? So if you look at, if you look at the squat here, you can see my thighs are a little bit past parallel here, but you can see how that angle is past 90 degrees, right? So usually you can see there's a lot of flexion in this knee when I'm squatting. There's a lot of flexion. Whereas if you compare it to the deadlift position, my knees are flexed, yes, but not to the same severity as when I'm squatting, right? So with squatting, you're required to do a lot more knee flexion, whereas on deadlifting or any type of hinge movement, you need a lot less knee flexion, okay? So that's the biggest difference there. That's something we want to see or just keep note of. All right, then let's look at things straight on. So the first 2 pictures here, right, are just kind of starting position, then what a normal squat looks like in the sagittal view or looking straight on. Again, the pictures I was just showing before with the squat and the deadlift here, those are from a frontal plane view or a side view. When we're looking at sagittal view, that's mean we're looking something straight on, front and back. All right. So first 2 pictures, just normal, nothing's wrong. The third picture there, what I'm trying to show you is like some valgus knee, especially on my right side, or if you're looking at the picture, it's the, sorry, I'm saying that wrong. It's my left side or the right side of that picture there. You can see how that knee is caving inwards. So that's kind of trying to show a situation of a valgus stress on the knee or genu valgum. Whereas on the right side, I'm trying to show a little bit of genu recurvatum or some bow-leggedness while squatting. Now again, genu valgum and genu varum are not the same as having a valgus or varus movement at the knee. Genu valgum, genu varum, and genu recurvatum are more of kind of almost congenital defects where your bones have adapted and grown to be into a position where you're always in that biomechanical fault, so to speak. Whereas if you have a valgus knee, it's just in the process of where your knee is caving inwards like I am in this picture here. Or having a varus knee where my knee is caving outwards. That's what I'm showing in the 4th picture there. All right, so valgus knee is, I'm really showing valgus and varus stress in my knees where I don't have an actual true case of genu valgum or genu varum. Okay, so that is a key difference there to take note of as well. All right, now I'm kind of just trying to show the same thing here with the single leg squat. Of course, if you want to do like a full pistol squat, again, that's going to require a whole lot of knee flexion. But here I'm just trying to show you from this frontal plane view, obviously the knee is going to go through some flexion, of course, depending on how low you're going to go with your single leg squat. But usually, of course, you need a lot of good quad strength in order to be able to control that, and foot strength, so that way you don't get a valgus moment at your knee and everything caves inward. So the second picture there, you can see everything's in normal alignment. I'm doing pretty good. The third picture there, I'm trying to show you where my knee is caving inwards a little bit, so I'm having that valgus stress on my knee. And you can also see at that point that my arches of my foot have also caved in. So I'm pronating excessively, like we talked about last time. Because of this pronation, it's also going to cause my knee to cave inwards or have a valgus stress. Now, if you look at this last picture, I'm a little bit more supinated in my foot, right? So now that's creating a little bit more varus stress on my knee, making it look like I'm almost more bow-legged, okay? So yeah, usually what's happening at the knee, it's usually not always a case of the problem with the knee. It's usually with the foot and or with the hip. And again, we're going to look at problems with the hip when we talk tomorrow at this time at 7 p.m. But let's keep going ahead here. So again, same video here, we're going to look at the jump shot. Last time, again, we looked at the ankle. But now if you look at this jump squat, right? So as we jump up, as I'm on the ground, I'm trying to leave up off the ground. I need to concentrically contract my calf muscles, my quadriceps, and my hip extensors, meaning my glutes and some of my hamstrings there, right? In order to be able to leave the ground, all three of them need to act together. But when I'm landing and I'm coming back down in that process, right? Because when I'm up in the air, my legs are straight, my legs are fully extended, my knees are fully extended, right? So as I'm landing, my knees have to go from an extended position into a flexion position. But because I'm going to a flexed position does not mean I'm using my hamstrings. My quadriceps are going to still take a lot of the force when we're looking at the knee. And instead of looking at a concentric contraction when we're landing, we're looking at an eccentric contraction when the muscles are lengthening. All right. So I'm not saying that the hamstrings aren't active at all during a jump squat. By all means, that they definitely are. But the quadriceps, looking at the knee, are going to be what helps slow us down and stabilize and keep our balance and so forth. All right. Okay. And this last one here I thought would be interesting to look at here. We're going to look at just a simple walking. So as you can see here, I'm trying to time it right. So as you kind of finally reach out, right, as we're swinging your leg through, it's easier to see when I'm walking forward a little bit, that first step that I take, when your leg is swinging forward, to the point where right before your heel hits the ground, we always think, oh, your knees, your quadriceps are extending your knee out, so that way your leg's reaching out in front of you, so that way you can land and not trip and fall, whatever it may be. But it's also it's more so your hamstrings controlling an eccentric contraction to not, control how fast your leg is swinging outwards. All right, so yes, your quadriceps are concentrically contracting to bring your leg outwards, but your hamstrings are also eccentrically contracting to control how fast that swing is occurring as well. And then again, when we go ahead and push off, right? So as we're in the process after we have heel strike, we have a little bit of an eccentric contraction of the quadriceps to do some shock absorption. And then, And then after, so as we're pushing off, right, we get into that hip extended, knee extended position. We're in a bit of a dorsiflexion. And then once we're in that dorsiflex position, we're going to use our calf to push off. And we're going to use our hamstrings to push off as well to help flex our knee. And once our knee is flexed and our heel is going towards our butt and it's about to swing through, going through that swing phase, it's that knee and our tibia is going to accelerate forward. And again, it's going to be our quadriceps to accelerate it, but then our hamstrings are also going to decelerate it right as we're going to heel strike or put our heel on the ground. All right. All right. Well, hey, listen, guys, that is it for today. I hope you guys got some value out of this and found it useful. Again, keep checking back for more videos as we'll be continuing to push out more content and help you guys the best we can.